is a male at 74 years. The total number of COVID-related deaths stands now at 15. And so we certainly express our condolences to the family members of the deceased. I'd like to also say regrettably that today represents an extraordinary day over the last 24 hours at least for COVID-related positive cases, as today we have confirmed some 98 new samples that have tested positive for COVID-19 in the last 24 hours. 10 of the 98 are from the backlog cases, and so the rest, 88, are cases that are current, which of course is cause for some greater levels of concern. I would like to add before going further that the Prime Minister and I have spoken, and there will be a meeting tomorrow morning of the Special Committee of Cabinet, the Subcommittee of Cabinet to deal with COVID issues, at which point a discussion will be had around the recent number of cases, and further decisions would be taken as it relates to how we proceed as far as the COVID response is concerned. As you know, it is something that we monitor on a daily basis, and the Prime Minister is on record, as am I, of saying that if there are surges or spikes, as the case may be, that requires further assessment and response, then those decisions will be taken in the public health interest. And certainly in terms of the numbers today, it does suggest that there is need for an analysis of the numbers, which has started, which is why we're late, and decisions, of course, are taken by the Cabinet of Jamaica. And so that committee will meet tomorrow to study and take the necessary decisions. The total number of confirmed COVID-19 cases in Jamaica is now at 1,290. The newly confirmed cases are 46 males and 46 females, and 52 males, with ages ranging from 4 years to 80 years. The cases were recorded in St. Thomas, 5, Clarendon, 7, St. James, 4, St. Catherine, 17, Kingston and St. Andrew, 53, St. Mary, 3, St. Anne, 3, Westmoreland, 2, and Manchester, 4. 10 of the 98 cases, as was said earlier, were imported, 8 arriving from the USA and 2 arriving from India, 7 contacts of confirmed cases, and 80 are under investigation. 1 local transmission not epidemiologically linked. In terms of recoveries, 16 additional cases have recovered and been released from care. Total recoveries now stand at 788, or 61% recovery rate. 71 patients were repatriated to their countries of origin. There are now 416, or 32.2%, active cases currently under observation. There are 8 moderately ill patients, and there is 1 critically ill patient at this point in time. In terms of classification, the 1,290 cases are classified as 429 imported cases, 404 cases that are contacts of confirmed cases, 104 local transmission cases not epidemiologically linked, 236 related to the workplace cluster in St. Catherine, and 117 under investigation. The gender classification, 54% of the confirmed cases, or 692, are females, and 46%, or 598, males, and the ages ranges from 2 months to 88 years. So far, up to the last 24 hours, we have done some 50,683 samples have been tested, with 49,279 negative and 114 pending. In the last 24 hours, 1,468 new samples were tested. I think it's important to note, and Dr. Hamilton will certainly elaborate on this, that the testing has improved significantly, the efficiency of the testing, and she will speak to the clearing up of backlog and what we're doing just to ensure that the numbers are current, which gives us relatively real-time information so we can respond in terms of the interrogation and the further investigation that is required. In terms of state and home quarantine, 9 persons of interest are in quarantine at government facilities, while some 28,741 are in home quarantine. So the vast majority of persons who are placed in quarantine based on the protocol, the 14-day period when they come into the country, 28,741 are in home quarantine. And, we can elaborate on this later on, but, that for me represents a significant part of the risks that may be manifesting itself now in some of the positive cases that we have. We depend a lot on persons to observe the quarantine protocol when they come in. Some 2,000 to 2,500 persons come into the island each day based on the easing of restrictions. They are asked to stay home for 14 days, assessed, and of course contact their health center or hospital if there are symptoms. And frankly speaking, one of the challenges that we face is that not all of those persons are observing the quarantine orders, and that is something I think that will occupy the minds of the cabinet or this cabinet subcommittee tomorrow when the Prime Minister convenes for a discussion. The community quarantine, there are 2 parishes with communities under quarantine, as has been announced, Clarendon and St. Thomas. The Sandy Bay in Clarendon and in St. Thomas, the quarantine areas are Lower Summit, Church Corner, and Bamboo River. The efforts on the ground continues in those communities, meeting with residents, collecting information, doing testing where necessary, as well as the support to provide food packages, medication, and of course we thank the team on the ground, or the teams on the ground, including the Constabulary and the JDF, for working with the public health team, Ministry of Labor and others, NHF, to ensure that the citizens in these communities are given the best possible treatment. And we thank them for their patience, which is very important as we seek to cauterize the challenges or the COVID spread within these communities. Based on our information that we've garnered over the last few days, we've had to extend the quarantine period in those communities. The Prime Minister announced the extension, but we have also, and that is up to September 2nd. We have also, however, had to add 2 more communities in St. Thomas, Albion and Seaforth, as part of the quarantine communities. And this is a result of positive cases that have been identified, and in the view of the public health experts, the fact that there is some spread taking place, and the best approach is to cauterize and to try and neutralize the spread as quickly as possible. And the support would be best through restricting movement within those communities. So those 2 communities, Albion and Seaforth, the quarantine period began at 5 a.m. today, Thursday, August 20, 2021, and will run for 14 days ending September 2nd. These communities have seen some 13 cases over the last few weeks. Many of the cases are symptomatic, and it's important to note that because it is in the display of symptoms that spread takes place more readily. The coughing, the sneezing, and it is the droplets that will spread on surfaces or on individuals, which creates the kind of multiplier impact. And so it's very important that the symptomatic are detained, if you will, in an institution or at home in order to control the possibility of spread. So it's a big cause for concern and for transmission. Community surveillance will be carried out over the next 2 weeks to detect any new cases and to implement appropriate measures to contain spread within the parish. We assess each day, so if it is determined that we are making progress even within that period, we will determine as to what the next steps will be, which could include anything from lifting to extending. But the team on the ground would need some time to assess and to make a recommendation. The parish health departments and our partners have been on the ground and continue medical surveillance, welfare and public education, as well as pharmacy services through the National Health Fund. And shopping days in these communities remains, as is the case in the other communities, Mondays, Wednesdays, and Fridays. In terms of a summary of our efforts in Sandy Bay, Clarendon, and Lower Summit, Church Corner, and Bamboo River in St. Thomas, as at Wednesday, August 19, it's as follows. In terms of samples collected, Clarendon 334, St. Thomas 743, homes visited in Clarendon 1,077, in St. Thomas 465, persons interviewed 2,521 persons interviewed in Clarendon, 429 in St. Thomas. Persons reached by health education officers, 2,443 in Clarendon, 1,400 in St. Thomas. Prescriptions filled, providing medication through the NHF, 169 in Clarendon, 458 in St. Thomas. Team members on the ground daily, 45 in Clarendon and 51 in St. Thomas. And of course, the positive cases, 14 in the quarantine zone in Clarendon and 37 in St. Thomas. Let me just close this segment of the discussion by saying it's so important that Jamaicans recognize or remind themselves that the COVID pandemic is still real. It's affecting the world. I mean, many countries are experiencing surges now. And Jamaica, as far as the assessment appears, is seeing a surge in cases. We have always maintained that with the lifting of restrictions, the risk profile of the virus would change. We have always maintained in public health and indeed the government that the assessment would be done on a daily basis, and the extent to which there are changes that may represent an increased threat, then clearly the government will consider, take advice, and will make an appropriate changes in the interest of the country. We have also said, just to remind the public, that as we move to restore a sense of normality to our society, to our economy, by allowing persons greater freedom of movement, not just within country, but between ourselves and other countries, and that risk profile adjusts, we would be preparing ourselves to place greater emphasis on surveillance at the community level, and that's why we have engaged 1,000 community health aides. We have trained them and retrained those already in the system. That's why we have adjusted, because of the sheer numbers, the concept of home quarantining as opposed to institutional quarantining. And all combined would mean a different approach to managing COVID. Now, I would like to say, and I know it may seem not the case because of the sheer numbers, but I would like to say that I think the adjustment that we have made as public health and indeed as a country from a policy perspective, where we have adjusted the strategy to monitor through surveillance and to respond or intervene based on the intelligence that we gather on the ground, that system is working. Indeed, most of the cases that are picked up to date are cases that are linked to some form of investigation, contact tracing of original cases or initial positive cases. So we are gathering the information, discerning what is happening, and intervening as appropriate, which is why we quarantine communities. Now, that does not mean that this strategy may not have to be adjusted in terms of pulling back on the easing of some of those restrictions. It ultimately is the call of the cabinet, and the cabinet and the prime minister has never been afraid to make that call where that call is necessary. So I have full confidence in his ability and in the abilities of my colleagues to do so. But public health's advice on the issue is going to guide that process. And so I say all of this to say to the public, while it is concerning that we have 98 cases in a day, 88 being current, the highest number of cases that we have had, it hopefully is not a signal to the populace to panic. It is, however, a signal to the populace to renew their commitment to the COVID protocols that we have established. Wearing of the masks, sanitizing, 6 feet distancing. It is a commitment to be our brother's keeper, and for those who are breaching the home quarantine, to advise them sternly not to, and or to report where you think it is necessary so that appropriate action can be taken. Because frankly speaking, it represents now a weak link. And, all of us have to play our role. The government alone cannot do it. The public health team alone cannot do it. While I think they are doing well in picking up these cases and responding to these cases, if the rest of us don't play our part, then we can easily be overwhelmed by the sheer numbers. And that is what is of greatest concern from my perspective as minister, and I'm sure by the government and indeed by the public health team. So we want to just move now to summarize the first page, and then we move to to Dr. Hamilton. Just in summary, again, to say that today we had, regrettably so, one additional death in the last 24 hours, a Clarendon male, 74 years, which takes the total number of deaths to 15. And we've had 98 new samples that have tested positive in the last 24 hours, 10 of which are from the backlog. So it predates the last few days, the other 88 over the last few days. And so representing the highest number of positives that we have had in any one 24-hour period. And I want to again reiterate the need for us to remain vigilant, remain committed to dealing with COVID. It's a challenge that we face here as others face. And for those who are not observing the protocols, I urge you again, it is important. It is not to be taken lightly. We must be concerned. And I encourage all of us to comply as is being prescribed by the protocols. Dr. Hamilton, I'm going to ask you now to just speak briefly on the testing arrangements, and in particular the status of backlog and what else may be happening that will improve the approach to testing.
The Honorable Minister is correct. I do have good news for you this evening. The reagents for the COBA 6800 that we spoke about, the last press briefing, did arrive in Jamaica on schedule, and so we have been able to clear the COVID-19 backlog of samples. So again, I know persons were waiting with bated breath to hear whether or not we have cleared the backlog, and yes, the backlog of samples has been cleared. I want to emphasize, though, that the reagents that we got in country were not just enough to clear the backlog, But we do have an adequate number of reagents in country to deal with not just routine surveillance, but with surveillance exercises coming out of all the investigations that will be required around the new positives. So, in short, we have surge capacity in the system and we will be able to ramp up the testing as required. So the backlog is cleared, we have adequate reagents, and we are able to meet any challenges that may come our way at this time with respect to testing. I want to also repeat something that the minister has said a number of times this evening, but it bears repeating. Of the 98 new samples that have tested positive, only 10 were from the backlog. That means that 88 of these samples are samples that are from recent days. And it's important for us to recognize this because we don't want to get into a situation where we think that most of the samples are from the backlog, so we're just reporting on what was. But right now, nothing much is happening. We want you to be aware of the fact that the backlog samples were minimal compared to the samples from recent times. Now, this does not have to cause us to panic, get alarmed. What we are saying is this: we all need to pay attention to the recommendations that have been made. We all need to adhere to the social distancing, to the wearing of masks, and to hand sanitization to ensure that the levels of COVID positive samples do not continue to escalate. So we have enough samples, we have enough reagent to test at this time, but we are asking that you work with the protocol so that we don't need to be doing a lot of surveillance testing around new cases, because together we are going to keep those cases down. Thank you.
Thank you very much, Dr. Hamilton. So a positive news there that we have, in fact, managed to bring the backlog under control, basically, to clear up the backlog. So hopefully we will keep it that way. And the capacity of our testing institutions now allows for us to test relatively freely without much hindrance, and therefore we hope that the numbers from here on in will represent the current cases, which helps us in the planning process, helps in the recovery process, helps us in the containment process. So it's all around a very positive development. Okay, I'm going to ask now the Chief Medical Officer to speak to St. Thomas, where on the ground there is a lot of activity taking place based on the community transmission that we're observing, which led to 2 other additional communities being restricted yesterday. CMO.
Good evening, everyone. Thank you, Minister. So just want to give a little overview of what is happening in St. Thomas so that the public can be aware. So the St. Thomas Health Department was notified of 3 cases of coronavirus in April 2020. And between April 2020 and July the 31st, we had no other cases reported. However, since then, the parish has had 89 cases up to August 16th in the space of about 17 days, including 1 death. And then for the last 3 days, we have had additional cases that have brought us up to 107 cases. So essentially, over the last 3 weeks, we have seen a spike in the number of cases from St. Thomas, going from 3 cases that was prior to the end of April to 107 additional cases in the last 3 weeks. Now, these cases have been reported from across all the 4 health districts of the parish, but the majority of the cases, over 50% of the cases, are from the communities of Church Corner, Bamboo River, and Summit. These 3 adjacent communities were named a quarantine area on August 6, 2020. And this just gives us a map of the area that was placed under quarantine. Next slide. Now, up to August the 16th, we can see that the number of cases had spread right across the parish. So we were seeing cases from about 19 communities across the parish. Since then, between the 16th and the 19th, we've had additional cases, 17 additional cases coming from additional communities. And so therefore we have about 25 communities across the parish that we are seeing cases. Next slide. Now, this map gives us a visual feel of how the cases are occurring right across the parish. So from on the western side of the parish, from Albion going to Yallas, Pomfret, and in the center of the parish where we have the community quarantine in the Morant Bay area, Spring Gardens area, Seaforth, York, and then going across to the eastern part of the parish, Erie Castle, Port Morant, Barking Lodge, Hampton Court, Wheelers Field. All these communities have been affected. Next slide. Next one after that. Next slide. Right. The lines gives us an idea of how these cases are connected. And we can see here that many of the cases have been connected and actually arise out of the problem that we had in the quarantine area of Church Corner, Bamboo River, and Summit. Next slide. So the positivity rate as at August the 16th for the parish was 7.8%. And the positivity rate for the entire parish remains high. And for the community quarantine area, we had a positivity rate of 16%. I would just want to remind the public that overall for the country, we have a 2.8% positivity rate. So these rates are considered to be quite high. The positivity rate for the Morant Bay Health District, which includes the quarantine area, is 12.3%. For the Golden Grove Health District, 15.4%. For the Trinityville Health District, 15.2%. And for the Yallas Health District, 15.9%. The positivity rates for the Golden Grove, Trinityville, and Yallas Health Districts are similarly high. The highest positivity rate occurs in the community and quarantine area, as we had indicated, and the lowest positivity rate in the Morant Bay Health District overall for that health district at 12.3%. Now, I had mentioned before the amount of communities that have been affected, and therefore this extent of what was happening in St. Thomas has triggered us to look at this threat that there is to this entire parish, because there's a significant risk of exposure for persons living in the parish, persons who travel to the parish, and persons who traverse the parish. And as such, we have instituted 2 other quarantine areas in the area of Albion and in the area of Seaforth. Now, as you can see from the presentation, several other areas are having problems, but it is our intent to slow down the movement in the parish and to focus on these areas where we notice that there are a higher number of cases in order to try to clear those communities and overall to reduce the number of cases that we've seen in St. Thomas. The positivity rate comes out of the intensive quarantine surveillance activities that we have been doing in the parishes, because the positive of this method of dealing with these outbreaks is that when we go and look for the cases, we pick up cases quickly. We don't wait for them to present to us. We pick them up when they are asymptomatic, and we're able to remove these cases from the community. So a high pickup rate in this area is what we aim for, to find out all the positive cases and to be able to keep these away from the rest of the communities to prevent spread and therefore to cauterize what is happening in the parish. And this is what our intent is for the other quarantine areas And essentially, in all the community surveillance, we intend to pick up the cases. And so you are going to see our numbers of cases going up, because with every case that we investigate, we do intensive contact tracing and surveillance within the communities to find the positive cases, essentially before they find us, and to be able to manage them appropriately and therefore to cauterize the problems that we are seeing. Thank you.
Okay, thank you very much. So there you have it, ladies and gentlemen. We've given our report and a few updates, particularly as relates to testing and St. Thomas. And as I said earlier, the subcommittee of cabinet that looks at COVID and the COVID response will have a discussion in the morning, and those discussions will center around the announcements today, but also an assessment over the past few days. And based on the advice, based on an appreciation of what is happening, appropriate decisions will be taken, I'm sure, and the public will be made aware. We continue to monitor the situation, but we also, very importantly, continue to encourage persons to respect the protocols and to, work with the public health team and other stakeholder groups to ensure that we minimize the risk of exposure. Stephen?
Thank you very much, Minister. I'm going to invite our media colleagues to use the raised hand feature. If you have a question for the members of the team, we're going to begin with Emma Lewis.
Sorry about that. Can you hear me okay?
Yes, go ahead, please.
Okay. Quickly, does